வணக்கம். Welcome to this course on classics in neuroscience. In the last few videos, we have been looking at neural systems and the neural basis of behavior. In this video, we will look at the hypothalamus and its relationship to feeding behavior. We will also discuss the dual center hypothesis of feeding and satiety. And we will discuss the seminal work of Jacques Lemagnan towards feeding and food intake as a complex behavior. To understand the neural mechanisms in feeding, people studied by creating hypothalamic lesions, that is lesions in the hypothalamus. And what they found was that ventromedial hypothalamus, if it is lesioned, it makes the animals that has had the lesion to keep on eating, leading to obesity, overeating. So, it was hypothesized then that maybe the ventromedial hypothalamus is the satiety center, is the place or is the nucleus that signals that an animal is full, is the satiety center. Later, people studied the lateral hypothalamus and found that that is the feeding center. So, these papers are from Hetherington and Ranson in 1940, where the lesion was in VMH and the animal keeps on eating, becomes obese. Essentially, the satiety center has been compromised. This leads to a situation in which the animal, even after eating, does not feel satiated. So, it keeps on eating and becomes obese. Later, in the paper by Anand and Brobeck, lateral hypothalamus was lesioned and it was found with this the animal stops eating. So, it is likely that the lateral hypothalamus is the feeding center. So, the satiety center, once it gets activated, will inhibit the feeding center, and the feeding center, once it becomes activated, will inhibit the satiety center, is an expectation, because these two go hand in hand. So, these two centers lead to the so called dual center hypothesis of feeding. This hypothesis was framed by Elliot Steller at Penn. There is a 1957 paper in which he proposed that maybe these two centers are together, maybe they can be called as dual centers, that led to the dual center hypothesis of feeding. Later, it was realized that these centers are not very easily defined with the boundary, and rather this function is spread out across many regions, across many neurons, well beyond these particular boundaries. So, this hunger and satiety essentially define the axis of feeding behavior in animals. Jacques Lemagnan can be considered as a pioneer of behavioral analysis on feeding behavior. So, he is one of those doyens, he is one of those stalwarts or legends of this field who studied feeding behavior. His history, his story is worth learning about. He was born in 1916 in France. Unfortunately, due to some global epidemic, he lost eyesight at the age of 12 due to encephalitis. Despite the fact that he did not have eyes, during wartime Paris, he actually obtained a bachelor's degree, and later he joined the laboratory of sensory physiology in Collège de France. There he developed olfactometers, meters that can measure the strength of the odors. So, these olfactometers can actually measure the volatility, the concentration and the respiratory rate or the inhalation rate of the olfactory stimulus. So, he started studying the role of olfaction in feeding behavior in rats. So, this idea that smell could somehow lead to increase or decrease in food intake was at the time novel, and he actually controlled the odor and the strength and the amount of stimulus. Depending on that, he was able to observe the changes in the feeding behavior, systematic experimental approach. So, Lemagnan concluded that food is a complex condition stimulus. Essentially, the intake of food is the outcome of a fine balance that exists between hunger and satiating factors, depending on the sensory aspects of the food. So, what are the sensory aspects of the food? Aesthetics, how good looking it is, one, how it feels to touch, for example, or how will it feel in the mouth to the touch sense. More importantly, how does it taste? Also, how does it smell? So, these are the senses. Right? You cannot hear food, but all the other senses work. But most importantly, he found that removal of specific odor increased the intake of food. Essentially, odor serves as the sensor or sensitivity mechanism to signal the amount of food that someone is taking. So, if the odor is removed without having that much sensitivity, the animal continues to eat, or if you change the odor, then it stimulates the appetite. So, food intake is dynamically controlled by the flavor of the food. Now, it is easy for us to see why. Now, it is somewhat clear as to why the food industry is very particular about increasing the flavor or changing the flavor in the food so as to maximize food consumption, because that will increase their sales, that will increase their bottom line. But excess food consumption by anybody leads to disease, in particular diabetes. So, this is something that we need to keep in mind whenever we order or buy flavored food, because it is meant to keep you eating more and more. So, thus suppressing the activity perhaps of the satiety center. With this, we come to the end of this video. In this video, we looked at how early studies on hypothalamus and feeding behavior indicated that hypothalamus may be a location, may be a nucleus that may be responsible for mediating food and satiety. Later, Steller came up with this idea that there was this dual center hypothesis of feeding, that the VMH is the satiety center, whereas the LH is the feeding center. And the work of Jacques Lemagnan, who despite the loss of his eyesight, having that prodigious memory, he developed these olfactometers and how odor controls food intake. With this, we come to the end of this video. Thank you for your attention.